Hello and welcome to Nurse's Handbook. Today I bring to you some golden points to remember which may help you in giving out your vivas easily and clearing your various nursing exams. First point to remember is the schedule for antenatal checkups. Basically, antenatal checkup comes under the antenatal care and it is a type of preventive health care. The schedule for antenatal checkups include monthly visit during the first 2 trimesters, that is from 1 to the 7th month, or we say first week to the 28th week of gestation. During the 8th month, that is from 28th week to the 36th week, fortnightly, or we say 2 visits per month should be done by the mother. After the 8th month, that is during the 9th month, or from 38th week to 42nd week, weekly visits should be done by the mother. Second point to remember is Sigmund Freud, who is well known as the founding father of psychoanalysis, gave the triple-decker model of id, ego and superego. Id, which focuses on instincts, ego, which is based on reality, and third, superego, is based on morality. Third point to remember is the Ballard score, which is used to estimate the gestational age of child and is usually used in the first 24 hours after the child is born. It is based on neonate's physical and neuromuscular maturity. There are 6 parameters in the physical maturity which is assessed. Similarly, there are 6 parameters in the neuromuscular maturity which is assessed. The scores for each may range from -1 to 5 and the total score may range from -10 to 50. Premature babies will have low scores and babies born late will have high scores. Fourth point to remember is that the chief source of estrogen in the 3rd trimester is placenta, and this estrogen allows the uterus and placenta to create new blood vessels and transfer nutrients to the developing fetus. Whereas in early weeks, that is before the formation of placenta, corpus luteum secretes estrogen and progesterone. Fifth point to remember is deficiency of serotonin or 5-HT, that is 5-hydroxytryptamine, is found to cause depression. There can be many other causes like changes in hormone levels, family history, early childhood trauma, pre-existing medical conditions, etc., which can cause depression in a person. Sixth point to remember is circumstantiality. It is a disorder of thought process in which thinking proceeds slowly and the person brings many unnecessary and trivial details in between before reaching to the final point. It is commonly seen in patients suffering from schizophrenia, obsessional disorders, and in certain types of dementia. The 7th point to remember is immunization and fortification of food with specific nutrients are an example of primary prevention. 8th point to remember is that the midday meal program was introduced in 1961 to improve the school attendance by providing supplementary food from school to the children. In September 2021, midday meal scheme was renamed as PM Poshan or Pradhan Mantri Poshan Shakti Nirman. The 9th point to remember is an incident report is a formal document that details the facts related to an incident at the workplace. The report usually relates to an accident or injury that has occurred on the work site. An incident report is also known as an accidental report. 10th point to remember is Kussmaul's respiration is associated with severe metabolic acidosis and diabetic ketoacidosis. Thank you for watching. For more updates like this, do like, share and subscribe to our channel Nurse's Handbook.